All right, now we'll talk about EMDR. EMDR stands for Eye Movement Desensitization Response. Um, According to the principles of EMDR, psychopathology occurs when information processing is blocked. The idea is that when individuals go through something traumatic, the person is unable to process fully through the experience. When the individual is unable to process the experience fully, it is thought that it somehow influences neurotransmitters and pathways in the brain in such a way that it's like it um, cannot be resolved in a sense. I know Jordan has done some work with neurofeedback and different biofeedback techniques, and he could probably talk to us quite a bit about what is thought to occur or what is occurring in the brain around trauma. Um, but the idea behind EMDR is just this notion that in order to help someone work through a trauma, we need to facilitate brain activity. The way this occurs for EMDR folks is some sort of bilateral body movement. If you've had brain and behavior, you know that the human brain is organized bilaterally. There's a slit down the middle, the corpus callosum goes over the top, and information is readily exchanged. Um, the hypothesis of the EMDR folks is that when a person experiences trauma, the bilateral communication flow um, does not occur readily or effectively. And so most EMDR techniques utilize some sort of motion, eye motion, body movement, series of lights, hearing, where one side of the body is activated, then the other, one the other, one the other, one the other. All of this occurs while the individual is holding in his or her mind the memory of the most painful traumatic event. It is thought that while that memory is held in consciousness and different sides of the brain are activated, that this will, in a sense, be like freeing the dam. So if trauma is a dam in a river that makes it impossible for the thoughts to flow freely, that it's kind of stuck, that this bilateral activation will move the earth or the dam material down the river, and the person will be able to process in a much more rational and reasonable way, rather than activating the limbic system such that an individual who has been a combat saw live combat in Iraq, and apparently before explosive devices go off, they often make a noise that sounds like a pen clicking. Well, I've had students in the past who, when they're sitting in the classroom, if someone is clicking their pen repeatedly, that can be very anxiety provoking. Because think about it. I mean, if you're in a combat situation and this sound reliably predicts that something's about to blow, it's very important for the brain to learn that. Yes? And it will be learned in a very deep way. Well, now the soldier is back. As far as we know, there aren't any explosive devices planted around Avila, and that sound no longer reliably predicts an explosion, but that would be learning that would be difficult to overcome. Yes, it made good sense at the time for the person to experience intense anxiety as a result of that sound. EMDR is a controversial form of therapy. Many people in the exposure and response prevention camp don't believe that the bilateral movements have anything to do with the reduction in anxiety that people experience after EMDR. That essentially, when people undergo EMDR, what they do is they come to the therapist's office, they recreate painful emotional memories, but they do this in the presence of a warm and caring therapist. And for the exposure folks, that's enough. This ends up being superfluous. One could have, I don't know, been drawing circles on a piece of paper at the time that they were relaying traumatic memories. And because the distress level goes down, people might begin to think, oh, it's circle drawing. Circle drawing is the thing that resulted in change. But the exposure people are saying, no, it's not that. It's the fact that you were telling your story in a safe environment with a warm and caring therapist. You were exposing yourself to that which you've been avoiding. That's what brings about change. So research should continue to explore this, and we will see the outcome. All right.